Hello, you're watching DD India. It's a new day and we're back with a new episode of Wellness Watch, a special show curated to ensure a healthy you and to acquaint you with a wide array of possible treatments and medical procedures India offers for various ailments. Let's embark on this medical journey. Wellness Watch with me each week. I'm your host, Preeti. Cosmetic surgery, also known as aesthetic surgery, is when a person chooses to have an operation or invasive medical procedure to change their physical appearance for aesthetic reasons. However, it also raises important ethical, social and health-related concerns that warrant careful consideration. Today, in Wellness Watch, we discuss cosmetic surgery and the medical procedures available in India. In the race to redefine beauty, India is witnessing a cosmetic surgery boom like never before. Once a luxury reserved for the elite, cosmetic procedures are now accessible to the masses, transforming lives and redefining self-confidence. But how does it work? Is it safe and is it really necessary? Here's our report.
From fat reduction surgeries to Botox and hair transplants, cosmetic surgery has become a thriving industry in India. Social media plays a major role, feeding the desire for perfection as people compare themselves to picture-perfect images. But beyond aesthetics, cosmetic surgery is also a lifeline for those looking to reclaim confidence and overcome insecurities. Cosmetic surgery, a subset of plastic surgery, focuses on enhancing physical appearance. Popular procedures include facial surgeries like facelifts, nose jobs and brow lifts, aimed at achieving youthful looks. For those struggling with excess fat, liposuction targets areas like the stomach, thighs and arms, sculpting a slimmer figure. Non-invasive options like Botox and fillers erase wrinkles, while hair transplants restore hairlines and self-esteem. Laser treatments are another favorite, addressing skin blemishes and unwanted hair. These procedures promise quick results, but the path to beauty isn't without risks. It's crucial to understand that every procedure carries risks, from infections to nerve damage. The key is to choosing a qualified board-certified surgeon and being fully aware of potential complications. India's affordability is a driving force behind this boom. Cosmetic surgeries here cost 30 to 50% less than in Western countries, attracting patients from around the world. Medical tourism is flourishing, but affordability doesn't mean cutting corners on safety. Precautions are just as vital as the procedure itself. Post-surgery, patients must avoid cosmetics, stay indoors, and maintain a healthy lifestyle for optimal results. Cosmetic surgery offers a pathway to enhanced beauty and self-esteem, but it's not without its challenges. The risks, expenses, and long-term impacts must be carefully weighed. For some, cosmetic surgery is life-changing. For others, it's a cautionary tale. As India continues its rise in this billion-dollar industry, one thing remains clear. Beauty may come at a cost, but informed decisions make all the difference. Remember, beauty is not just skin deep. It's about feeling your best, inside and out. Harshita Oberoi reporting for Wellness Watch, DD India.
Alright, cosmetic surgery can have significant positive effects on an individual's self-esteem and quality of life. People who undergo cosmetic procedures often report improvement in their confidence and mental well-being as their appearance aligns more closely with their personal ideals. Additionally, cosmetic surgery plays a crucial role in reconstructive procedures for patients who have suffered traumatic injuries or congenital anomalies. In cases where individuals have lost parts of their face or body due to accidents, diseases, or birth defects, cosmetic surgery offers a pathway to recovery, allowing them to regain their functionality and appearance. Today, in Wellness Watch, we find answers to some very prominent questions. What is cosmetic surgery? What does cosmetic surgery treat? How long do the results last? We also discuss the risks and benefits of cosmetic surgery and also the medical advancements that are available in India. The main idea of this show is to acquaint you with institutes and hospitals and to tell you how India is a medical hub for the rest of the world and how it offers cost-effective, reliable treatments for various ailments for which people prefer coming to India. Up on your screens, we will have some institutes and some hospitals which treat the ailments, and today we are discussing cosmetic surgery, we are discussing plastic surgery. All India Institute of Medical Sciences, New Delhi, Jawaharlal Institute of Postgraduate Medical Education and Research, Puducherry, Lady Hardinge Medical College, New Delhi, Government Medical College, Surat. Now, these are some of the colleges and institutes and hospitals which India offers for patients to come for cosmetic surgery. All right, today we're joined in by guests also. As always, we're joined in by guests in the studio who will be sharing more insights into cosmetic surgery. We're joined in by Dr. Sushma Sagar, Professor and Incharge Trauma Surgery, AIIMS, Delhi. And we're joined in by Dr. Vibhu Mendiratta, HOD, Dermatology, Lady Hardinge Medical College, surgery. Yes, she's from Lady Hardinge Medical College. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. To begin with, Dr. Sagar, I would want you to explain to our viewers the basic difference between plastic surgery and cosmetic surgery.
See, basically for an academician it is a plastic surgery and plastic and reconstructive surgery, but for a layman it is a cosmetic surgery. So anything which is improving your enhancement, they call it as cosmetic surgery, but in academic terms we call it as burns, plastic and reconstructive surgery. So wherein your own body tissue is being used for realignment of your disfigurements or deformities which are either acquired or which may be congenital. Cosmetic is sometimes when with the help of other measures like for Botox, by liposuction, you are augmenting whatever is there. You are not removing or you are not deleting anything from your body part, you are just augmenting it to enhance it. So for a lay person it can be cosmetic everywhere, but for an academician we always call it as a plastic surgery, and plastic means is to mold. Basically whatever is deranged, whatever is disfigured has to be molded in it to its natural shape.
All right, I'll take that forward to Dr. Vibhu. Dr. Vibhu, why is it then that people, liken plastic surgery and cosmetic surgery one? And when we talk of cosmetic surgery, how popular has it become now?
So, to answer first question of yours, that why do people think that plastic surgery and aesthetic surgery are more or less the same. So, as Dr. Sagar explained, that something which molds your body shape, body deformity, body imperfections, so that is aesthetics. Aesthetics would mean that you are enhancing the appearance of any individual who is not satisfied or who's having any scar, any imperfection, any deformity. Plastic surgery is, if we take it, it's a term which is a bigger term. It is an umbrella term that it may involve a real time surgery which could be a big surgery. It could be a smaller procedure which could be just a very initial component to do with your aesthetic enhancement. So that's why there is an overlap these days for the common man. But as far as the medical field is concerned and the medical specialists are concerned, so the spectrum and the scope, if we say, of plastic is much higher, much wider and much widespread. Aesthetic is a smaller branch of plastic surgery.
All right, Dr. Sagar, what does cosmetic surgery treat? I mean, what kind of patients do you get? Is it always about beautification?
No, see, when we talk about government setup in government hospital, majority of the patient which we get is like who have got either they have congenital anomalies, that they have birth deformities for which they want some kind of corrections, or there can be because of following burns or following trauma, there is a facial deformity, there is a deformity to the extremity or to any other body parts. So, they all come to that. But when we go to the corporate setup or in the private setup, mainly it is you can say that something which is to enhance your appearance, which could be either hair transplant or your brow lift, facelift. So, liposuction for your tummy reduction or for your arm reduction. So, those liposuction kind of procedures. So, there is a spectrum of patients which come to the government setup or in the teaching hospitals or bigger hospitals, and in the corporate you can have different varieties of patient depending upon what they want to cater to those patients.
All right, Dr. Vibhu, is it that cosmetic surgery will always get you the desired results? Is it, what is the success rate? I mean, when patients come to you, they would be coming to you with doubts,
Yes.
with inhibitions. How do you treat that?
Yes. So, I think it's a very fundamental question before we discuss the various aspects and the various procedures. So, when we talk about the success rate, first of all it depends on the procedure itself as to what one desires and how much of that can be corrected. That depends on the procedure. So, say for example, it is a mole removal, like people will have those small tiny growths as part of aging, which is a normal natural process. So, you will have these small moles and small raised growths on the skin. So, they can be removed 100%, they are removable by simple procedures and without any complications. So, I would say that there we guarantee 100% success rate. But when we come to other procedures, like it is about correcting the pigmentation, which is a deep pigmentation by laser. Okay. So, it can never be a complete removal of that pigmentation from the skin, it is just an improvement. So, we would just tell the patient that you may get improvement over what you have, say about 75% improvement, 80% improvement, 90%. So, that will vary on many of the patient related factors, the disease related factors for which it is being done, performed. It also will depend upon the performer, the operator, whether the person is got adequate experience. It will also depend upon the machine also. So, there are many determining factors which will ultimately control and have an impact on the success of a procedure. Certain procedure, I would say that they are safe, they do not have any life threatening complications, and they are the ones which can be easily undertaken in any outdoor setup also. But the patient has to understand, because even any simple injection is not free from the side effect. There is no guarantee, it is a medical field. There are certain unpredictable things which are there, which we do not know about the patient also, and how the patient's skin will react to it ultimately. So, all these things are evaluated in the pre-procedure counseling and evaluation. You need to sit across the table and you discuss all these aspects in your first encounter with the client.
All right. So, that was about when the person comes to you for a plastic surgery or a cosmetic surgery. But then when it is done, are the results always permanent?
Yeah, no, the results are not many a times permanent. Supposedly, like you've undergone a liposuction procedure. So, it's not permanent. If you're not changing your lifestyle, if you're not using those dietary instructions which have been told to you, you will again regain. Rather, it will be a rebound phenomena for you. So, basically, these procedures are not permanent. I always tell my patient that what God has given you cannot be reconstructed by anyone. So, and we should not be like impressed by the industry people or those who are in the Bollywood or the Hollywood, because their constant job is to keep check on their appearance. But for a normal person who has to go to the office, who has to do the household chores, who's a teacher or a doctor or any other person, we should not be like influenced by those people, and we have to understand what are our needs, whether I am in a public dealing or I am in a professional job. So, what satisfies me? So, that question is very important. Like ma'am just said that we need to discuss in length about the desires of the patient. That's why the psychological and psychiatric assessment of these patients is very important, because they are so worried about their body image, and until unless we cure their mind, will not be able to cure their physical appearance.
This is a very important point which you've put forth on this public platform. I'll take that forward to Dr. Vibhu. Dr. Vibhu, we are talking of risks and benefits. Now, we've talked of benefits, but then what are the risks associated with cosmetic surgery, with plastic surgery?
Yeah. So, I will take up the aesthetic
Yes.
component, because as a dermatologist, we would be performing these procedures almost on a daily basis. So, for me, it's very important to apprise the client in the first meeting itself as to the do's and don'ts that the patient or the client is expected to observe when the person decides to undergo a procedure. Like Dr. Sushma said, that it is not a one-time fix which is going to last forever.
Yes.
It's a lifestyle modification of factors which have given rise to those cosmetic issues. That is number one. Say for example, the sun protection is very important, hydration is very important, your diet itself is very important, you are minimizing your cosmetics and your harmful agents, cosmetics that you are getting exposed to, that is very important. So, it is a detailed evaluation and assessment of the patient. Risks would also depend upon how much is the adherence of that particular patient to the advice that we give, because many a times in the Indian scenario we see that they are not able to actually adhere to the advice given to them. Like for example, we would tell them that their sun protection has to be very, very strict and very rigid, but they would not use a sunscreen. So, with the result, even when we treat the pigmentation with laser, it comes back. There are certain conditions like melasma or blemishes which we often see in the Indian skins, in the ladies it is very common. So, despite giving them good medical and this laser treatment or even other procedures like PRP is there, it tends to come back. So, sometimes the patient feels that it has not been treated, it has come back. So, all these things, the nature of the disease also has to be told to the patient. And other risks would be sometimes some patients they have bleeding disorders. So, they can be more bleeding, the bleeding would not stop in certain procedures. There can be infection if the it has not been certain patients who are diabetics, their diabetes has to be under control, hypertensives, and even those like patients who have these electric these pacemakers inside, they are not to be taken up for electrosurgery, because that can interfere with the electrical rhythm of the heart. So, there are lots of precautions, and long term also sometimes post procedure, the major side effect in Indian skins that we see could be a dark discoloration of the skin. There can be hyperpigmentation post laser, or sometimes there can be a depigmentation. The skin over where this procedure has been performed, that can show a lighter discoloration of the skin.
Is there any particular age group for which cosmetic surgery can be done?
Yes.
Plastic surgery can be done?
Yes. So, for cosmetic surgery, generally for these procedures which are for enhancement of the appearance, generally we take them up after 18 years of age, once the adulthood has been achieved. So, maybe for the plastic surgeries, like there are genetic deformities which need to be corrected, which are playing some, they are interfering with the life functions and the functioning. So,
Is there any particular age group, ma'am?
No,
for plastic surgery to be
no,
done?
there is no particular age groups. It can start from a child of 1 month's age to a person of maybe 90 years, because in 90 years you have certain creases on your face which you don't want to be there. So, but see, the important thing is that when you are talking about plastic surgery, it involves some kind of anesthesia. So, whether it is a local anesthesia or it is a general anesthesia or a regional block. So, the complications are associated with that. So, depending upon that, what is your underlying body morphology, if you are on steroids or if you have any coagulation disorder or if you are allergic to certain drug, then you may not be fit for those anesthesia to undergo under those anesthesia procedures. So, that is very important, that person has to understand. Secondly, that you are undergoing a knife. So, you need to choose your facility and your surgeon very particularly. This is not something which is going to kill you. You know, if you have any disease which is going to kill you, you definitely need a surgery. You can go undergo surgery at any place whichever is nearer to you. But when you are choosing for a plastic surgery or a reconstructive surgery, you have to choose the speciality, you have to choose your time, your availability, because it may require multiple surgeries. So, it cannot be कि नहीं डॉक्टर साहब कल ही कर दीजिए and I want to get rid, I have taken just 1 week's leave and I want to get cured in that 1 week. So, those kind of pressure should not be there.
All right, we are discussing plastic surgery, we're discussing cosmetic surgery today on a Wellness Watch. For our viewers who've just joined in, we are joined in by guests in the studio who are sharing more insights into cosmetic surgery and plastic surgery. We're joined in by Dr. Sushma Sagar, Professor and Incharge Trauma Surgery, AIIMS Delhi, and we're joined in by Dr. Vibhu Mendiratta, HOD Dermatology, Lady Hardinge Medical College. Dr. Sagar, what kind of medical advancements are available in India when we talk of plastic surgery, you know, for people from the rest of the world to come to India? What options are available?
Yeah, I would say that there is a very big ray of hope for people who are in the Western world, and we see a lot of people coming from various parts of the different countries to our country, because what we find is that despite advances and despite very high fee here, still we provide very good treatment and surgical options to people living abroad at a very I would say less cost and less hospital stay cost, and we can provide, I mean, at par what treatment facilities you get in other Western worlds. We can provide the same facilities here in our country, whether it is in the higher government setup, places like All India Institutes or central institutes, as well as various medical colleges in the country and in corporate also. So, all kind of advancements are there. We have very high 3D printed implants which are available, which can take care of earlier. For certain defects in the body, you know, we were using the bone grafts, but these days there are titanium implants which can be customized according to the defects in the patient, and they can be used for the patients. Similarly, various implants, various prostheses are available, and they can be used.
I'll take that forward to Dr. Vibhu. When we talk of cosmetic surgery, what medical advancements are available in India? Very quickly.
So, lots of medical advancements are there in the field of cosmetic dermatology and surgery. We do perform lots of procedures which are like starting from, we have facial rejuvenation, periorbital rejuvenation with the help of injections, with the help of fillers. We do Botox, we do like fillers also are available, and then taking from there we also do the energy based devices are there, which are state of the art laser machines that are available in many of the government institutions. So, we have all the lasers to correct the scars which are there, and even to tackle the pigmentary problems that are there. Then the hair reduction lasers are also available. So, some patients will have this problem of extra hair growth or hirsutism. We also do PRP, which is again a regenerative medicine, and which corrects many scars, pigmentation, and it also helps in boosting the hair growth as well. Then there are other procedures like micro needling of the skin, which is basically resurfacing the skin, and many of these patients would have post acne scars. Then there are procedures for keloids or hypertrophic scars which are left behind post some injury or injection or burn. So, these patients they can get their treatments.
All right. So, both our doctors explained to us the difference between plastic surgery, cosmetic surgery, and also how both of them are popular these days when we talk of the medical advancements available in India. Very quickly, we will also have a quick rapid fire question round for our viewers to get some myths cleared. Dr. Sagar, first to you, only women get cosmetic surgery, is it so?
No, it's wrong. I would say that men are more going towards the cosmetic surgery.
All right, Dr. Vibhu, cosmetic surgery is always risky, is it so?
It's not.
Okay. Dr. Sagar, cosmetic surgery, or for that matter plastic surgery, does it always lead to an unnatural look?
No, not always, but yes, sometimes it may.
Are results always permanent, Dr. Vibhu?
Results are not permanent.
And plastic surgery is always painful, And it involves long recovery methods. Is it so, Dr. Sagar?
No, one should not get discouraged by these kind of statements. With better anesthesia advancement and better machinery and equipments, we are in a better state now.
All right, and non-invasive procedures yield the same results as the surgical ones?
Yeah, similarly. I mean, they are comparable.
All right. So that was about it when we talk of cosmetic surgery, plastic surgery, and we thank both our guests for joining us in the studio this afternoon and explaining to us the difference between the two and how in today's world cosmetic surgery and plastic surgery is gaining popularity, and also the medical advancements, the medical options that are available in India. For cosmetic surgery, it is said that come as you are, go as you wish. Every year, cosmetic surgery procedures help millions of people feel more confident about how they look. These procedures can enhance your appearance and improve your self-esteem, but it is important to have realistic expectations as that has been put by our doctors. Be honest with your provider about what you hope to achieve from cosmetic surgery. Follow your provider's instructions carefully when recovering from any procedure. By staying healthy overall, you will increase your chances of healing properly and getting the results you want. Remember, there is no cosmetic for beauty like happiness. And with that, on that note, in fact, we end this edition of Wellness Watch this afternoon. Till we meet next, take good care of yourselves. Bye-bye.